Hello, my name is Vin Tone. I'll be covering what you can do when you combine VisuFlow with Microsoft Visio. What do you think are the main components in a medical center? There's the people, the equipment, and places. The most important people are the patients and their family members. Then there are the staff that take care of the patients, the equipment that the staff uses, and the places where the equipments are stored and people go to and from. What you see is Microsoft Visio. All these components are represented by shapes. A collection of shapes are called stencils. This is the VisuFlow patient stencil. With these stencils, you can easily drag and drop a patient, drag and drop a family member, add a staff like a nurse, likewise a doctor, or equipment like a wheelchair, an MRI machine, and places like a desk, an ambulance, a department. Microsoft Visio can have data associated with shapes. VisuFlow takes advantage of this by associating the data with visual attributes, which will allow you to explain complex concepts with simple visuals. For example, consider the acuity of a patient. It could be low, it could be high. Consider their satisfaction. It could be happy, sad, confused. Or the rank of a staff. It could be a supervisor, director, their specialty. It could be cardiology, surgery, their capacity. It could be low, it could be high. The state of an equipment. It could be disorganized, dirty, and so on. There are numerous attributes that you can discover when working with VisuFlow, such as your patient experience. Let's walk through how the patient gets dropped off by an ambulance, registered, admitted to the ED, triage, seen by a doctor, eventually admitted to a nursing unit, and ultimately discharged. See how acuity affects your staff. Understand the distribution of your employee engagement. Strategize an adoption plan for change. Empower and leverage your champions to win over passive supporters. Turn the tide on passive resistors with a majority buy-in. Prioritize how your facilities is maintained. Focus your response on equipment that is utilized the most but take the least effort to maintain. Visually build collaborative practices. Look for interdepartmental handoffs. They tend to have the most opportunities for improvement. These are just a few examples of what you can do with VisuFlow.